travel with buddy. So this is a foldable pram that is specifically made for CP kids as well, and it's one of the things we'll start issuing in the course in the next few weeks. This is another standing frame. It's something we use in therapy, so it's a lot more durable, so the child can stand facing this way or facing that way. In terms of speech therapy, they often get specialized bottles because they have feeding issues. We have specialized cups, which just makes feeding a little bit easier for the mom as well. Textured spoons, which give them exposure to different types of textures, so in preparation for feeding different foods that have different textures as well. In this section, a lot of our CP kids actually have visual problems. So it's not the eyes that's the problem, but it's the processing in the brain that is the problem. So usually we use the dark den with lights, so it's a sort of light therapy. And we try and activate the brain so that they can recognize things. Very often they see yellow or they see red first, and those are the colors we harp on mostly. In terms of the smaller area this side, is mainly where we would be seeing a lot of our autistic children. So they need more confined space with less distraction. Very often these days very overstimulated. So especially in the community, in conversations, at parties, or out in the world, these are noise cancelling music, so which you use as well. So sometimes once they take kids to church, the music is too loud. So they come across as a native child, but they're not. It's just all the noise that's too much for them to process. So this helps to cancel out the noise. This is an ASC class. It's the entry for ASC is alternative language communication. So very often a mommy comes to you and they say they want the child to talk, but there are other ways to communicate. This is one of the ways we try to communicate. So the button. So we can record mommies. We start with simple instructions like this and then eventually evolve to a little board with multiple buttons that can communicate with our child. So as long as they've got the ability to use their hands, they are able to speak another way of communication. That's also much more recognition in talking as well. On this side is all our toys. So we use different toys to stimulate the kids, different toys to encourage movement or understanding or utilization of their hands. A lot of our things are very textured. So CP is a multi-sensory disorder. So their senses are affected in every aspect. So everything we have either makes a noise or is a special color or feels a different way, so they can experience the world like we all do, but just in therapy. The equipment towards the left is our gross motor equipment. So your children with CP have different levels. Some are very low functioning, can't do anything on their own, and some are actually quite high functioning with minimal deficits. So it could be balance or coordination, or something simple as rotation of the thumb is an issue. So some of the equipment may seem like a child who has a severe disability can't utilize, but it is a spectrum. The kids come in with different types of problems. And the very good thing about our services at Evander Hospital is that we see the child from birth. So early intervention is key. 40% of your premature population end up with cerebral palsy. So we have programs in place in the maternity unit, so in the high care room, where we position premature babies in a very special way to try and control the sensory environment so that the brain develops optimally. So brain development happens from 28 weeks. So as soon as baby's born, as soon as they stabilize, we start intervention already. And it's non-invasive, it's around positioning, teaching the mom how to handle the baby. And once they get discharged, we see these kids for 12 months. So we run a high-risk clinic every single Friday. So every baby that has come through rehab from a neonatal point of view gets seen by us. The very good thing about this is that very few of our kids
have developmental concerns if we have seen them from the onset. And the even better thing is, if we see a problem, we can address it immediately. So the sooner you intervene, intervention under the age of 2 is imperative. There is so much you can make in a child who has neurological impairment if we intervene under the age. That come in after the age of 2 already have secondary complications. So they may have deformities or other secondary complications, and it makes therapy a little bit more difficult because your timeline is now a lot shorter, where you can see an absolute difference between a child that is seen from birth and a child that comes in at the age of 2. So your child coming in at birth is more functional because it depends on how much the brain is damaged. So if the brain is severely damaged, that child has less contraction, less complications, the mum is more comfortable to handle them. There's less chance of them needing a peg for feeding, or less chance of them needing additional assisted device, if I could put it that way. So your child who comes in a little bit later needs so much more. So that mom often needs much more counseling because she hasn't accepted what's happened with that child. And obviously for these mums, it's a journey they haven't planned. It's like going to Italy. You learn Italian, you've got a dictionary, you know it's going to be hot, you take all the right things with you. Now you come and you have a baby who has concerns or has developmental problems, and it's not the journey you planned for at all. And I think that's the main thing I want you to take from this, is that we need to intervene as soon as possible. We need to be understanding of that mum and the journey she's traveling, and specifically for the medical staff, be understanding this is not what the mum planned at all. This isn't what she envisioned. And if we're not going to support that mum, it's going to be very difficult for her to accept that the child is severely disabled. But I think the most fantastic thing about CP is that it's a spectrum. It's not that every single child ends up the same way. Every child is different. And the sooner you intervene, the more you intervene, the more beneficial it is. The sad thing is that we often don't have the capacity to see everyone as often as what we would like to. So very often we see the patients once a month because that's either what we can in terms of staff capacity, or that's actually what the mummy can afford as well. But we try and push as much as what we can, give them as much as we can, try and spend as much time with them, which is often limited to 45 minutes to an hour because there are other patients to be seen as well. And the beautiful thing about Evander is that we have every profession at hand. We have the dietitians, OT, physio, speech, audiology. So I often tell the moms when they complain about waiting for too long, and I'm like, do you know how privileged you are? You come to Evander. Under the age of 6, the kids don't pay for anything. They come and they get OT, and they may get a buggy. They see the speech therapist, and they may get a specialized communication aid. They go to the dietitian and they get supplements. They go to the social worker and they can let go, and the social worker can help in terms of finding a placement for the child if needed. They can go to the audiologist, and if they need a hearing aid, they'll get that as well. And imagine all that services in one day and all those benefits they get as well. So we try and instill in our moms that coming here is an absolute privilege, and that government is doing so much to assist them, and obviously they've got a part to play in it as well. So we only see them for that bit, but the therapy actually continues at home. So we harper a lot on home programs, on sustainability of what we do as well. Moms often take videos of what we do so they can implement that at home as well. We are a very happy team for this building. It's not just a once-off gift like blankets or a food parcel. I think, it's a lifelong privilege. I've been working for government for 20 years this year, and I think this is probably one of the greatest achievements of my career in terms of having something like this. If you visited us many years ago, we had, and now we have double the size of what we had. So I think we are extremely, and all the stakeholders and Department of Health for accepting this. I think there's lots more to come. You are welcome to pop by any point in time and see what we do. So unfortunately today is actually our ward day. We see our outpatients on a Tuesday and a Thursday mainly. So it's a bit unfortunate that you don't get to see any of the kids. But pop by on a Tuesday and a Thursday and you can see what we do in action. The moms are very grateful who come here. They come to the appointments. They try not to miss their appointments. They'll send us a WhatsApp to change the date if they have something else planned, or they'll send a sister or a cousin to say, please change my date. But they appreciate what we do. And I think we're also a group of therapists who love what we do as well. So thank you for your time. I don't know if you have specific questions.
I can see you love what you do and you explain the whole and how happy you are.
We are very, very, very happy.
Yeah, no, we love our people because you don't have to tell us.
Glad you can feel it.
Yes, we love our people. And the department wants people like your good staff. You have not been complaining, they've been working, and that's why today the Eskom are coming to support the good work that you're doing. So really appreciate your passion, the love for people. We hope you're still young. These days you can look at us and think we are young, but we are old. We are old.
Another 20 years.
Yeah, no. So you must treat other people.
Definitely.
Yeah, no, thank you very much. Thank you.
Thank you.
Yeah, thank you.
So when are you ready for the